I'm Shane and welcome to Skyline Psychology. If you're here, you've likely made an appointment with a psychologist and maybe you're wondering what you can expect in your first session. Psychology sessions can understandably feel daunting. We're a scary bunch. Though rest assured, we don't sit behind you with a clipboard asking questions about your relationship with your mother in thick Austrian accents. That's very last millennia. So I'll share with you some of the things that I do with clients in the first session that might help you feel prepared for when you see your psychologist. Therapy is a bit of an art, and while we psychologists all have similar-ish training, the practicing of the art may vary. So what I'm sharing with you is my flow, while also keeping in mind Medicare and the 10-session rebate system in Australia. Like with most health practice settings, there are forms. This will include important information gathering forms and the all-important informed consent, and maybe some questionnaire about your level of distress that week, something like that. Sometimes these can be filled out online, but if not, come a few minutes earlier to fill them out in the waiting room. Then take some slow, calming breaths. Most psychologists are punctual. The psychologist will likely greet you in the waiting area and invite you in. Guided by the psych, sometimes you can choose where to sit, sometimes they'll choose for you. So now you're sitting, and hopefully it's a comfy couch. My recommendation is the Ektorp from IKEA. Nice cushions nearby. You should notice some drinking water, some tissues, all the ingredients for a great therapy session. So then we go through informed consent and all the admin bits that I won't include in this video because I'm more interested in the stuff that comes after. So we're in the room, hopefully settled in, gotten through the admin related things, and you haven't run out the door. Thank you for hanging in there. And also, thanks for viewing the video this far. Now we usually talk about the assessment-y nature of the first session and what that means. Generally in session 1, we'd like to know more about your current situation that brings you in. Any symptoms you might be experiencing, any struggles, stressors, irritations, anything at all that's bothering you. These issues are also generally viewed within a context. And so we look at what brings you in more broadly across biological, psychological, and social environmental domains. They all work together. In the biz, we call this the biopsychosocial model, and it's just one of many tools in our toolbox to better understand you. Understanding your historical setting is another important client-centered, universe-expanding treasure trove. This can help us understand the way you think about things, the things you do in daily life, any assumptions you have about the world, yourself, others, and we want to understand how these things have developed across your lifespan. The bottom line with this stuff is that the more we know about you and where you've come from, the better and more targeted treatment can be. So it is better for sure to say you don't want to answer a question than give information that might not be true. There may be some tough questions or issues that you're not ready to talk about yet, and that's okay. Just let us know and then we move on. We might come back to it at another time. Sometimes we can get through all of this stuff in one session, and sometimes it can take a little bit longer. We're pretty complex after all. We do all this to be able to tailor strategies, tools, and techniques to help you get the most out of your sessions. By the end of the second session, we should have a pretty clear picture about what your struggles are, what diagnosis you may have, and what the treatment plan will be into the next sessions. Finding the right psychologist is important, as people want to feel safe and comfortable sharing some of the deeper parts of their lives. So please don't feel bad if you come to the end of your first, second, or any session and think that the psychologist and their methods may not be a good fit for you. Sometimes a GP may even refer you to a particular psychologist, and if you feel that you don't gel with them, the last thing you want to be thinking is, great, now I'm stuck with this guy. The best thing to do is to speak with your psychologist about this. Though if that feels tough, letting admin know is the next best thing. That way you can be rematched with another therapist at the practice or choose a psychologist from a different practice altogether. We as psychologists generally want you to get the most out of your sessions, and there are no hard feelings. We really enjoy seeing our people flourish, and we want what's best for you. It's important for clients to feel in control of the process at all times. Psychologists generally come to the process with the attitude to be helpful. And so, if we're not hitting the mark and we're taking you to places you don't want to go, please tell us. Feedback is so valuable for us and the process more generally. So, I hope you found the information in this video useful, and thank you for watching. Speaking of feedback, if you liked what you heard, please like, share, and subscribe for new videos in the future. Our channel has information, tutorials, and even a film review. I encourage you to check them out. If you have any questions, you can always call us or contact us via the website. The link is in the description. Drop a comment if you want to comment, or if you have any suggestions on what other videos you might like to see.